Welcome to Communicating, Connecting, and Advocating, Advancing Sexual Health and Wellness for Black Women. Moderating today's conversation is Dr. Alftan Dyson. She's head of strategic medical partners at ViiV. She's a pharmacist and an HIV advocate whose work connects science, strategy, and community care. So joining her in today's dialogue, we have Dr. Oni Blackstock, physician, researcher, and founder of Health Justice. Next up, Olivia G. Ford. She's the editorial director at the Well Project. And finally, Carli Gray, a community advocate and strategist who uses storytelling and culture to build spaces of care and social change. This important session is powered by ViiV. Please welcome our panelists.
So as she said, I'm Alftan Dyson and work for ViiV Healthcare, which is a pharmaceutical company. And so we are bringing forth this conversation around sexual health and wellness for Black women. But of course, Black men need to be a part of that conversation too, right? And so she said, yes. She said, absolutely. And so just a little bit about what we're going to talk about. So it's really about risk to reasons and reframing how we have conversations about sexual health and wellness. And so you heard me say risk. So oftentimes you'll hear people talk about risk and somebody's at risk for something, but that doesn't resonate all the time because there's often a lack of a low perception of risk and what that means. So, and it can also be quite negative, right? When we say, oh, you're at risk for something. So instead we changed that language and we brought forth a group of folks to help us figure out what the right language was. And it was around reasons. Let's talk about reasons that we want to have conversations about sexual health and wellness. And so I want to now kick it to my panelists, one, to really give a little bit more introduction of themselves, but then talk about why reframe risk? What does this mean to you and why it's important to shift that language when we're talking to people, particularly Black women, about their sexual health and wellness. So I'll start on the far end with you, Carli.
Hello, everybody. Hello. It's just wonderful to be here to start out. I moved to Harlem when I first moved to New York. I lived on the same block as Madam C.J. Walker and her daughter, so this feels very full circle for me, and it's amazing to be serving y'all in this way. I would say that, to me, it really makes me feel like the main character when I'm shifting from risk to reason. We play so many roles as Black women, whether it's sister, daughter, partner, mother, not me, but somebody. And I feel like it gives me more choice. In films, we see main characters, they're not worried about anybody else. They're making sure they're doing what they have to do to feel safe, to come out on top, if that's what you prefer. And, that makes me feel strong and confident. So it's important to me to really talk about shifting that narrative.
Thanks, Carli. Dr. Blackstock.
Thank you so much. It's such a pleasure to be here. I have called Harlem home for the last 20 years. I often say Brooklyn raised me, but Harlem made me. And I'm acting like Brooklyn is like some other faraway country, but my dad made the trek up here a few years before I did, and then I came to Harlem. So Harlem has had a really special place in my life. It's shaped a lot of who I am as a physician, as an advocate, as a Black woman concerned about her community. My mother did her medical training at Harlem Hospital. My grandmother lived here in Harlem, and I also worked at Harlem Hospital for a number of years. So it is really an honor. It feels like just being at home. In terms of risks to reasons, I think about it from a healthcare provider perspective. Sort of the difference between if you go to see your healthcare provider and they say to you, do you know your risk of HIV? Versus, tell me what brings you in, what concerns do you have, what priorities do you have? And so the issue with the risk framing is that it often sort of makes the patient the problem, and it's about like, what's the matter with you? What are you at risk for? Versus, what are the things that are priorities for you? What's relevant to you? What motivates you? And so that is, to me, what that framing does. It also gives us as Black women back our narrative power. So we get to decide about our sexual health and sexuality. And these are things that have often been defined by systems outside of us. And so it's really an opportunity for us, again, I think, as Carli was saying, being main characters, being able to define what health and wellness and sexual health are to us.
Thank you for that. Olivia.
Hi, everyone. It's wonderful to look out on y'all here. And I love that we're all kind of sharing our relationships to Harlem. I also was born and raised in Brooklyn, but I also have roots here in Harlem. And I don't know that I've ever spoken to you about this, Dr. Blackstock, but my father actually also worked at Harlem Hospital many years ago. So definitely always feels like a homecoming coming up here, making the move. Again, not a long distance, but it's wonderful to get to come uptown. So now, as far as what risk to reasons means to me, you know what, I'll also say that I, in addition to, being a Black woman, I come to this work as a woman who is not living with HIV. It always feels important to say that, especially in kind of the context we're talking about with risk to reasons, because it really goes back to, especially in interactions with providers and interactions in community, with really just affirming our shared humanity, right? Again, as other folks on the panel have said, when we talk about things in terms of risk, that really kind of can put us on the defensive. It can feel, it can feel scary. It can feel like being othered. But really, when we shift to that reasons framing, it's really about, around sexual health and around HIV specifically, it's really about naming that we all have a relationship to an HIV diagnosis, whether we've had one or not, and that we all have a stake in uplifting the voices and the needs of all Black women, all people living with or vulnerable to HIV or with reasons for HIV prevention across the gender spectrum.
Yeah, thank you for that. And Olivia is also being a little modest. She helped us create this concept, this movement of shifting that language from risk-based to reasons-based. So we thank you for that, for partnering with us on that. And Dr. Blackstock too had some role in that as well. So I want to maybe highlight a little bit. You've heard each of the panelists say a couple of times around this work is about sexual health and wellness, but specifically how it relates to HIV. And so I mentioned that I work for a company, ViiV Healthcare, that all we do is focus on HIV prevention and treatment options, right? And so that's where we came to this conversation, this lens around this shifting the language from risk to reasons, because what we saw was a disproportionate impact of HIV on the Black community and also specifically Black women. And so when I say that, I tell people usually, I love statistics, I love numbers, and I talk about that we have about 39,000 new HIV diagnoses every year. And of those, about 40% are Black folks. And if we add people who are Hispanic or Latinx, it increases close to 70%. So it's a disease or an illness that predominantly impacts people of color. And then when we look at women make up about 20% of new HIV diagnoses, and of those women, Black women account for 50% of those. And so we wanted to understand, why do we see this disproportionate impact on the communities, on Black communities, and particularly when we looked at Black women? And part of that came out was the language isn't right. When we talk about risk, the perception, like our idea of being at risk for HIV is low. And then it feels like you're othered or things like that, and you're not centered as part of the conversation. So I love what you all were talking about. So I want to shift and ask you guys, another question about what are maybe some reasons that you've heard, in your practice or when you're seeing patients, but also as a Black woman, what are reasons that it might be important to think about having a conversation about your sexual health and wellness with your partner, with your provider, with your sister circle? Like, what does that look like? And then, maybe add in there, what would you like to hear from a provider, like who's having that conversation with you? I'll start this way this time. Olivia.
So now, some of the reasons that come up, especially, as having had the honor of being part of the Black Women's Working Group to reframe risk and really getting to bring up some of those nuances around around people's reasons for HIV prevention, reasons for talking about sexual health, and as far as the reasons for prevention, oftentimes, again, what was surfacing over and over is that there are conditions and experiences in our lives that are not necessarily ones that we have chosen for ourselves. When we talk about reasons for HIV prevention, kind of prevalence of HIV, oftentimes that has to do with, our neighborhoods, where we live, things that sometimes people need to do in order to survive, whether that's, needing to trade sex or just needing to have a roof over their head. Oftentimes these are things that these are needs that are being satisfied, and also just the need to feel close, the need to experience pleasure. And these are all the kind of reasons that were coming up for folks. And again, going back to my original comment, these are human conditions. We all need to survive. We all need to connect. And again, that was what kind of we kind of surfaced as far as really wanting to shift to talking about reasons rather than that kind of stifling, kind of othering conversation around risk.
Yeah, so Dr. Blackstock, your thoughts?
Yeah, just thinking from a provider perspective, it's really about, again, figuring out what matters most to our patients when we begin to have conversations with them about their overall health and their sexual health, and not imposing what we think they should know or what our agenda is. So asking questions like, what matters most to you when it comes to your sexual health or your sexual health goals? Keeping it really open-ended, being non-judgmental, being affirming, and hearing the language that our patients use to describe their lives and the richness of all of that, and reflecting that back to our patients in terms of what we're hearing. So it's also what ends up happening too with health professionals in training. A lot of times we have these like checklists. It's like, are you sexually active? Yes, no. Do you have sex with men, women, or both? And it's very, it's very disconnecting.
Mm-hmm.
It causes the patient to disengage. So it could be like, tell me about, your relationships. What's going well? What questions or concerns do you have? And really just normalizing the conversation so that your patient understands this is a discussion that's really about your health, and this is something that you do with all of your patients in terms of talking about these issues.
Absolutely. Carli?
Yeah, for me, I agree with all of those. And I think further, the reasons that come up for me is wanting me, my family, my loved ones, my friends to be able to make informed decisions regardless of what your desires are. So how are we making sure that people know, okay, well, if I fall in love with someone who's living with the HIV diagnosis, I don't have to refrain from being this or that. I can just fully deep dive plunge into being with this person who I chose to be with. And then more reasons, as Black women, we're trendsetters. When we back something, when we back a value, back a brand or anything like that, it's amplified globally. So why can't that be the same thing with when we talk about reframing the narrative around HIV?
I love that. I love that you said we're trendsetters, and I love that. It's true. We set trends, and so why can't we be the ones to set a trend showing that it's okay to talk about your sexual health, talk about sexual wellness, bring these conversations forward to your providers, but also to your partners, to your community, and share the information like broadly and widely with other folks as well. And I think I keep loving to hear this piece around centering self and doing what's best for self, right? And being able to make informed decisions. So I love that conversation. So I'll shift a bit and ask you, we're having this conversation, we're saying we should do these things, but what are some of the challenges for Black women that keep us from being able to have these types of conversations? I'll go in the middle with you, Dr. Blackstock.
Having these types of conversations with their partners or with community, or
I would say from your perspective with providers, like what makes it challenging to have a conversation?
Yeah, sure. I mean, I think a lot of times healthcare providers, we're not always getting the best training. And so the discomfort we may feel talking about these issues often gets projected onto our patients. So if we don't feel comfortable talking about sexual health, how people can take the best care of themselves, that's really going to impact the conversations that we have with our patients. So a lot of it is, I know a lot of the work that Vive also is doing is about, training providers. How do we have these important conversations? I would also encourage, our audience members to, if your provider is not asking about your sexual health goals as part of your overall health, raising that, saying this is something that's important to me and that I want to talk about with you. These may be some questions or concerns that I have. And if your provider isn't someone who seems open to supporting you in that conversation, looking for another provider that will support you. And if you have questions too, sometimes making sure that you're, maybe writing them down before you go, or maybe bringing someone with you, a friend who can be an advocate for you as you speak to your provider. But these can be really challenging discussions. But I think sort of what Carli said, Black women, we are like the entry point to our community. When we share a message, it resonates and it gets transferred to our family members, our children, our friends. And so a lot of this is also when you all have the opportunity to speak to one another, to speak to loved ones, to speak to colleagues, whatever it is sharing this information about how we can shift from risk, which is a blaming, to what are our reasons for showing care for ourselves and for others.
Yeah, that's wonderful. Great. Thank you. Carli.
I know exactly what I want to say, but still I was surprised when I got called on. So I think furthering that in the conversation, it becomes a challenge for Black women because we're so highly sexualized by the public at such a young age and throughout so much of our lives. This is before we know about consent, before we know about respect and boundaries and all the things that you should be equipped with when you want to be with a person in an intimate way. So when we do start to have those times where we want to enter those intimate relationships and we have questions, I think we then think, oh, well, now I'm really going to be what they said I was. Now I'm actually going to be, now that I want to be sexual, now I'm going to be sexualized and it's going to be exactly what they said I did. And so when we start to live for what we want, regardless of what the public and culture has placed on us, then we can really start to live, fully and freely. So I would say don't let what these perceptions of culture, the patriarchy, and all those things place on you to stop you from getting what you want, being fully equipped with all the things you need to do what you want.
Well, somebody felt that, Absolutely, you can clap for that. And I was going to say, you raised a really good point about, how we're viewed in the public. Like, I think growing up, I don't know, I don't want to tell my age here, but there used to be, what was it, BET Uncut, right? And so it's like all the things that were happening in there, and you think, oh, this is how I'm supposed to behave, or this is what it's like, like sexual behaviors. And it's like you didn't really get an opportunity to kind of decide for yourself what you like and what you don't like. It's often just kind of told to you what you should do and what pleasure should feel like for you if we listen to lyrics and songs. And so this is a reclaiming, right? As Auntie Maxine before, she was reclaiming her time. We're reclaiming our power when we shift from a risk-based conversation to a reasons-based conversation. Yeah.
I just want to lift up also what you're saying is that, a lot of times when we talk about sexual health, again, it's from a negative perspective. It's talking about what are the risks of certain sexually transmitted infections that someone might have versus from a pleasure-based perspective versus from intimacy-based perspective, or what might be more appealing to our patients, or what people might actually want for themselves and what might resonate for them, as opposed to focusing on risk. Because a lot of people are like, I'm not at risk. Why are you talking to me about this?
Yeah, absolutely.
Can I just say?
Yeah, absolutely. Go ahead, Olivia.
Yeah, and thank you all, both of you, so much for your comments, all three of you, really. But I just really wanted to sort of jump off that piece around how talking about sexual health in this kind of negative way around risk. And I'm just so grateful to, you as a provider and the way that you kind of model, kind of speaking to clients and to the community, because, I could retire right now if I, had $1 for every time that I've heard that particularly women have heard from a provider when they want to talk about sexual health, and they want to kind of talk about how to kind of be as confident as they can be and kind of and protect their own sexual health. They heard from a provider, oh, well, you don't need to worry about that. You don't need to, well, girls like you or women like you don't need to, be concerned about those things, or don't need to be concerned about prevention of all kinds, whether that's HIV, STIs, unplanned pregnancy. And really, it's just the part of that kind of reasons framing is really showing that connection, that when we talk about our reasons, part of it is having confidence to be able to explore all different kinds of pleasure with partners, with ourselves, and really having all the knowledge that we need and all of the kind of the tools to be able to do that in a really just grounded, pleasure-based manner, to just have the most sort of pleasure-filled lives that we possibly can.
Yeah, absolutely. I love that. So let's see, we talked about having the conversation, and you've shared a little bit, Dr. Blackstock, about, providers needing to do this more, maybe perhaps some of that training isn't there. So I guess I'm going to ask you, what are some practical ways, right, that providers can integrate this into their, practice with patients, their visits with patients, if there are some providers in the rooms, and what are the things that people should be looking for from their provider in having this conversation?
Yeah, and I want to ask a question related to that. I'm just wondering in the audience if you can put your hand up if this past year, if your provider, healthcare provider, has asked you about your sexual health. Okay, that's decent. I feel like that's like 20-30%. But honestly, if everyone has been to a healthcare provider in the past year, that should be at 100%. So again, it's really starting, like we need to have the conversations and come back to them. A lot of times we have a new patient, we may ask and then forget like years later, but things change in people's lives. So, again, I always say to my patients, I'm going to ask you about, your sexual health because it's a part of your overall health. My patients sometimes have questions and concerns. You might have questions and concerns, and I want to make sure I'm giving you helpful information and can support you in making the decisions that you want to make for yourself. And then just opening with something like really non-judgmental, like tell me a little bit about your sex life. Tell me, what's most important to you in terms of your sexual health. And a lot of times you get silence because people aren't used to being asked that question. And so I don't know if there are any folks in here who, even if you are, community navigators, patient navigators, talking to patients, really just getting used to having just asking some of these questions, because these issues are so taboo, they don't get talked about. So again, you say something about, tell me about your sex life. When I get the silence, I may say something like, well, tell me who does what and what goes where. That usually gets a giggle. And then and then you hear people then they'll start explaining to you things, and then you can use the language that your patients are using with you to talk about their lives and reflect that back. So again, and then, these other questions we have, like number of partners, things like that, just say, tell me about your relationships. Tell me about what those are like. And just getting that information in a way that, again, is non-stigmatizing, that is really creates space for the patient to be able to share their values, their preferences, their desires.
Yeah, so I think what I heard, a big takeaway from you, is making this a normal conversation and normalizing it, right? So you have this conversation every time with your provider, and it shouldn't feel abnormal or uncomfortable. Right now, it probably does if you're not doing it regularly, but it should become so much of the norm that it feels comfortable when we have the conversation with our provider. Yeah.
And just one more quick thing. I never knew I would probably say this phrase in the same room that my 83-year-old dad is in, but age is not a condom. So a lot of times these conversations don't come up because of the assumptions of the assumptions that healthcare providers make. But we know that, sexuality and sexual health, it's all of the lifespan. And so regardless of your age, your healthcare provider should be talking to you about these really important issues.
Absolutely. I love that one. So we're wrapping up. We're getting close to time here. So I want to ask, we've had a lot of great conversation here. I think, this piece about choice, reclaiming our power, right? Feeling comfortable and normalizing conversations around sexual health are some of the themes. So I'll ask each of you, and I'll start with you at the end, Carli. What's one key takeaway that you'd like folks to walk away with today?
I definitely want people to walk away with a curiosity to know more about your sexual health, how to talk about your sexual health, to know that undetectable equals untransmittable, to know what PrEP is, to know what PEP is, to know what DoxyPEP is.
What is PrEP? What is PrEP? You brought it up. I don't know if
Our
everybody knows.
PrEP is pre-exposure prophylaxis. It is a daily, but also I feel like you can do less daily doses nowadays that protects you and your cells from the HIV diagnosis. This is something that's highly accessible for people. And if you are finding out, that you were exposed to HIV, there's PEP, which is post-exposure prophylaxis. And if you're thinking, what is all this she's saying? If you Google it, put in PrEP, everything's gonna come up that you wanna know. And
Undetectable, untransmittable.
oh, yep, undetectable equals untransmittable. That's U equals U, meaning that if a person's viral load is undetectable, they cannot transmit the HIV virus. Therefore, please, if you know someone who is living with HIV, you can still hug them, you can still kiss them, you can still feed them and share community with them. So it's not touch it, I get it. You have so many ways that people living with HIV can live full, long lives, make families, and have great pleasure-filled lives. So I know that was more than one key takeaway, but remain curious and don't let the stigma keep you from educating yourself, because one day you're going to be sitting around the table educating someone else, and they're going to say, oh, I didn't know you knew that, but now you do.
Olivia, one key takeaway.
Well, first, just quickly jumping off of what Carli said about PrEP and PEP and U equals U, undetectable equals untransmittable, such important information and, kind of terms to go back and learn more about. I did want to call your attention to the fact that if you sat down on a chair this morning, you probably saw a little pamphlet that says Sexual Pleasure and HIV. That's from the Well Project, which is where I work, and I have the honor of working with all of our print materials. That's a little pamphlet that has more information about U equals U and PrEP and these methods as tools to just increase confidence and just increase connection and community, and just to really know more about the fact that really the kind of the basics of HIV, how we understand HIV, in the US and around the world has really changed really radically in just the past couple of years. HIV is a part of our community, but it's not a barrier to having just beautiful, pleasure-filled relationships, and certainly not to building community. So I would just piggyback off of that piece around staying curious and just keep on talking. Just talk about, just talk to one another. Talk to, push back with providers if they're not kind of bring up the topics that are important. Talk to your communities. Normalize, just really make these conversations about what you like pleasure, about health, just an everyday aspect of how we move through the world.
Perfect. Sounds good. And I think Dr. Blackstock gave hers. So I think there's a slide up. The last thing, you should have also had in your seats a resource around the Risk to Reasons framework. And so you could go to risktoreasons.com, or you can scan the QR code and get some more of the information as well. You probably had cards in your seat as well earlier today. So with that, I want to thank my amazing panelists here who had this conversation with us today. And I hope did you guys find this helpful? Did you find it useful? Fantastic, fantastic. And so we don't have time for questions, but we will be around. And if you see us, feel free to stop us, ask us questions, and we'd be happy to connect with you. So thank you.
Thank you, Alftan. Dr. Dyson.